over 60, doctors ignore this drink that lowers blood sugar. And before you scroll past that headline, hear me out. What we're really talking about is a simple kitchen drink that many clinicians rarely emphasize, but which may help stabilize post-meal blood sugar spikes for some seniors, while also supporting electrolyte balance. It's not a cure, it's not a replacement for medicine, but if your ankles puff by evening or your glucose jumps after meals, this is something practical you can try, carefully, and with your provider's go-ahead. Many older adults face two linked problems: swelling from fluid retention and post-meal blood sugar swings. Those might seem unrelated, but they share a common thread: electrolytes, especially potassium, and the way food slows or speeds digestion. Low potassium can make your body hold on to sodium and water, worsening swelling. And when a meal is absorbed quickly, blood sugar can spike. The good news is a single simple drink combines three things that help with both: potassium, healthy fats, and fiber. That combination slows carbohydrate absorption and supports your body's sodium balance. If you want more science-backed senior health tips, tap like. Here's the plain English connection. Potassium is a key mineral your kidneys use to help get rid of extra sodium. When potassium is low, sodium tends to stay, and water follows. That's a basic reason many seniors notice puffiness in the feet, ankles, or hands. Separately, foods that contain healthy fats and fiber slow how quickly carbohydrates turn into sugar in your bloodstream. Put those ideas together and you've got a rationale for a small, nutrient-dense drink that can do double duty: a gentle nudge toward more stable blood sugar and better electrolyte balance. Research has looked at how dietary potassium affects sodium handling and blood pressure. For example, studies summarized in the American Journal of Clinical Nutrition 2021, and other work discussed potassium's role in kidney health, Journal of Renal Nutrition 2022. Those studies don't promise miracles, but they do point to potassium as an important, often under-discussed part of the picture. So what is the drink? Call it the avocado electrolyte smoothie or the avocado coconut blood sugar stabilizer. It's creamy, easy to make, and centered on ingredients many kitchens already have. Here's a safe, practical recipe built for seniors and caregivers. Ingredients: half a medium avocado, 150 to 200 milliliters, about half to 3/4 cup, unsweetened 100% coconut water. Or, for a lower sugar option, use 3/4 cup unsweetened almond milk plus plain water. 1 handful, about 1 cup loosely packed, steamed spinach, lightly steamed for about 90 seconds and then cooled. 1/4 cup plain low-fat Greek yogurt, or 1 scoop of plain protein powder if you tolerate dairy, optional for protein. 1/2 cup water or ice to reach the texture you like, a squeeze of lemon or lime for flavor, and a pinch of cinnamon if you want.
Blend until smooth. Why these amounts? Half an avocado supplies a substantial amount of potassium, plus monounsaturated fat and fiber, all of which helps slow digestion. A modest amount of coconut water provides bioavailable potassium and magnesium, but also contains natural sugar, so we keep it small. For stricter blood sugar control, use unsweetened almond milk and extra water instead. A very short steam on the spinach makes its potassium more available and softens the flavor without breaking down the fiber. Protein, like a spoonful of Greek yogurt, adds another layer of stability, blunting post-meal glucose rises. This drink is meant to be a supplement, not a meal replacement, unless you deliberately balance it into a full prescribed plan. A few quick pointers on preparation. Choose ripe, but not overripe avocado, gives the best texture and flavor. Buy 100% unsweetened coconut water, no added sugars. Steam spinach for roughly 90 seconds, then cool it briefly before blending to preserve nutrients and leafy color. If your blender can't handle hot items, cool the spinach first. Start with 150 milliliters coconut water and taste. You can add a little more water or almond milk to reach your preferred consistency. Now, let's explain in plain terms why this works and why it's careful, not sensational. Potassium encourages the kidneys to excrete extra sodium. Less sodium retained usually means less fluid sitting in tissues. That's the physiology behind reduced swelling for many people. Avocado brings healthy monounsaturated fats and fiber, both slow gastric emptying, which spreads carbohydrate absorption over time and can reduce the size of post-meal glucose spikes. Spinach adds fiber and more potassium with very few carbohydrates. Coconut water supplies ready-to-use potassium and some magnesium. The small amount we suggest gives electrolyte support without dumping a lot of sugar into the drink. Taken together, potassium plus healthy fats plus fiber equals a beverage that may blend rapid glucose rises after a meal and support sodium balance. There's research context for each piece of that logic. Clinical nutrition literature has highlighted potassium's role in sodium handling and blood pressure regulation. American Journal of Clinical Nutrition, 2021. Kidney nutrition journals have examined how altering dietary potassium affects electrolyte balance in older adults. Journal of Renal Nutrition, 2022. Other metabolic studies show that dietary fat and fiber slow carbohydrate absorption and reduce postprandial glucose peaks. None of these studies say this one drink cures diabetes. Instead, they give a plausible, evidence-informed basis for why a potassium and fat-rich beverage, used correctly, can be a useful tool. How and when to use the drink. For most seniors, the safest and simplest approaches are these. Drink it between meals as a snack or have it about 20 to 30 minutes after a salty meal you suspect might cause swelling.
If you're testing its effect on post-meal blood sugar, try it as a small pre-meal or immediate post-meal supplement. For example, drink it 10-15 minutes before a carbohydrate-heavy lunch, or have it right after the meal. Don't use it to replace a prescribed meal plan without consulting your clinician or dietitian. If you need tighter sugar control, choose the low-sugar variant. Replace the coconut water with unsweetened almond milk and extra water, and add a protein source like plain Greek yogurt or an unflavored protein powder. If you want a slightly more hydrating, electrolyte-focused version after a day when you ate a lot of salty food, use the small amount of coconut water we suggested, 150 milliliters, and pair the drink with a source of protein, like a handful of unsalted pistachios or a small spoonful of Greek yogurt. Small protein pairings help blunt glucose rises further. 2 alternative variants to consider. Low sugar, high stability version, 1/2 avocado plus 3/4 cup unsweetened almond milk plus steamed spinach plus 1/4 cup plain Greek yogurt plus water/ice. No coconut water. This is best if you monitor carbs strictly or are on insulin. Hydration electrolyte variant. Use sparingly if you're monitoring sugar. 1/2 avocado plus 150 milliliters unsweetened coconut water plus steamed spinach plus 1/4 cup water. Add a bit of protein, Greek yogurt, if you tolerate it. Use this after a salty meal rather than as your daily routine if you're concerned about carbs. Pairing suggestions. A small handful of unsalted pistachios with the drink provides extra healthy fats and protein. A spoonful of cooked white beans on the side adds plant protein and potassium. A few celery sticks or a small piece of cheese can make the snack more filling without adding rapid carbs. Now, a quick practical roundup of the other potassium-rich foods you can use alongside the drink, and one simple tip for each, so you can incorporate them into daily life. Pistachios. Unsalted pistachios are an easy, portable source of potassium and healthy fats. Tip: aim for a small handful, about 1 ounce or 28 grams, as a snack paired with the smoothie or mid-afternoon to keep hunger steady. Dried apricots, concentrated in potassium but also in sugar. Tip: soak a small handful in hot water for 10-15 minutes and pair with a protein source like a few almonds or a spoon of cottage cheese to slow sugar absorption. Celery with leaves, low calorie and a source of potassium, plus it's great for sodium balance because it encourages fluids. Tip: eat raw with hummus or nut butter to add protein and slow carbs. Watermelon. It contains potassium and is hydrating, but it's higher in natural sugars. Tip: eat watermelon alongside a protein-rich food like low-fat cheese or plain Greek yogurt to blend glucose spikes. White beans. Beans are a potassium powerhouse and add fiber and protein. Tip: rinse and cook beans from dry for best texture. Toss a small scoop into salads or blend into hummus-style spreads. Coconut water. A natural source of potassium and magnesium, but it has natural sugars. Tip: use small amounts, 150 to 200 milliliters, or dilute with water to cut sugar while getting electrolytes. Steamed spinach, packed with potassium and low in carbs. Tip: steam briefly, about 90 seconds, to soften and boost potassium availability. Add to the smoothie rather than eating raw if you have a sensitive stomach. Avocado, one of the best single food sources that combines potassium, fiber, and healthy fats. Tip: aim for about half an avocado daily as part of meals or in the smoothie. It's very filling and helps slow digestion. Keep these practical pairings in mind. Combine higher sugar potassium foods, like dried apricots or undiluted coconut water, with a protein or fat. That pairing reduces the likelihood of quick glucose spikes. Safety. This part is non-negotiable. If you have chronic kidney disease, are on dialysis, or take medications that raise potassium, for example potassium-sparing diuretics like spironolactone, triamterene, or amiloride, ACE inhibitors such as lisinopril, or ARBs such as losartan, do not increase potassium intake without discussing it with your nephrologist or primary care provider. Excess potassium can be dangerous. It can cause hyperkalemia, which affects heart rhythm. Also, if you're on glucose-lowering medications such as insulin or certain sulfonylureas, start slowly and monitor blood sugar because changes in food can alter how much medication you need. The drink may change post-meal glucose patterns enough that medication adjustments are necessary, but only your clinician should guide those changes.
If you have normal kidney function and no medications that interact with potassium, this drink is generally safe in the suggested portions. Still, begin conservatively, especially if you have been advised to limit potassium in the past. A safe approach is to introduce the drink once a day for a short trial while keeping your usual medications until your clinician advises otherwise. Here's a simple 7-day trial plan to test its effects carefully and safely. Day 0, baseline. For 2 days before starting, record your usual pattern. Measure fasting blood sugar, then measure blood sugar 1 hour and 2 hours after one standard meal or after the meal that usually spikes your sugar. Also measure ankle or wrist circumference in the morning and evening to capture swelling. Use the widest part of the ankle and note the measurement in centimeters or inches. Days 1 through 7. Drink 1 avocado electrolyte smoothie once daily. Best testing moment, 20 to 30 minutes before the meal you want to stabilize, or right after a salty meal. Each day, measure blood sugar before the meal and 1 hour after, and record how your ankles feel and the circumference measurement in the evening. Note any dizziness, palpitations, muscle weakness, or unusual symptoms. If any of those happen, stop and consult your provider immediately.
End of day 7. Compare the week's blood sugars and swelling measurements to your baseline days. Share the results with your clinician. They can help interpret what changes are meaningful and whether to continue, adjust, or stop. Monitor for these warning signs: muscle weakness, numbness, irregular heartbeat, severe lightheadedness. Any of these could signal too much potassium and require urgent medical attention. Also be mindful that coconut water contains natural sugars. If you notice higher glucose readings after trying the coconut water version, switch to the almond milk variant and retest. Practical shopping and kitchen tips for seniors and caregivers. Choose ripe avocados, but not mushy ones. Freeze extra avocado in spoonable portions if convenience is important. Buy unsweetened almond milk or coconut water with a clear label saying 100% coconut water and no added sugar. Steam fresh spinach briefly rather than using canned or creamed spinach. If blending is difficult, a hand blender can work in a tall cup. Just be cautious with hot ingredients. If chewing or dental issues are a concern, this drink is naturally soft and easy to consume. A few realistic expectations so you don't chase a promise that isn't there. Expect subtle shifts, not overnight miracles. Some people see small reductions in swelling within days. Others notice better steadying of blood sugar over a couple of weeks when the drink is combined with other sensible changes: balanced meals, consistent medications. If you're on diuretics or heart medications and notice a major change in swelling or blood pressure, do not adjust your meds yourself. Contact the prescribing clinician. Let's talk briefly about common medications and interactions so you can bring the right questions to your appointment. Tell your clinician if taking any of the following: potassium-sparing diuretics, spironolactone, triamterene, ACE inhibitors, lisinopril and elapril, ARBs, losartan, valsartan, NSAIDs on a daily basis, or potassium supplements. Ask whether your kidney function is checked regularly and whether increasing dietary potassium is safe for you. If you're managing diabetes on insulin, ask how often you should check blood sugar when adding new foods and whether your clinician recommends extra monitoring around the time you try the smoothie. If you want to make the drink part of a longer-term routine beyond the 7-day trial, consider these practical scheduling ideas. Use it as a mid-morning stabilizer to prevent a heavy lunch, or as a late afternoon snack to avoid evening snacking that spikes glucose. If you eat a salty dinner and notice more fluid retention overnight, try the coconut water-containing variant the next day after a salty meal, but only if you're confident your kidneys and medications are compatible with a small potassium boost. A few myths to dispel right now. Coconut water is not a medical IV fluid or a substitute for prescribed diuretics.
It's a food with electrolytes, and while potassium-rich foods can reduce sodium retention in many people, they don't replace the need for medicines when those are indicated. Finally, doctors ignore isn't the right way to put it. Many busy clinicians focus first on urgent risks and medication management. Dietary potassium is an underemphasized tool in short clinic visits, not a conspiratorial secret. Use this drink as a low-risk, food-based strategy to discuss with your provider. If you're a caregiver, help by measuring and recording results. A simple notebook works. List date, time, fasting glucose, pre-meal glucose, 1 hour post-meal glucose, evening ankle measurement, and any symptoms. These notes will make your next appointment far more useful. Before we close, 2 quick practical recipes to keep in rotation. 1. Avocado electrolyte smoothie. Standard. Half an avocado plus 150 milliliters unsweetened coconut water or 3/4 cup unsweetened almond milk for lower sugar, plus 1 cup lightly steamed cooled spinach, plus 1/4 cup plain Greek yogurt, optional, plus half a cup water or ice, plus squeeze lemon. Blend until smooth. Drink between meals or 10-15 minutes before a targeted meal. 2. Low sugar avocado shake, strict carbohydrate control. Half an avocado plus 3/4 cup unsweetened almond milk plus 1 scoop plain protein powder plus 1 cup steamed spinach plus water or ice. No coconut water. This version minimizes added sugars while keeping potassium and healthy fats. Final safety reminder, if you have chronic kidney disease, are on dialysis, or are taking potassium elevating drugs, do not add extra potassium without your clinician approval. If you're on insulin or other glucose lowering meds, monitor your blood sugar carefully when you try new foods and discuss any consistent changes with your prescriber. If you decide to try this, do so with caution, track your numbers, and bring your results to your clinician. Many seniors find simple dietary tweaks add up to real relief, less evening puffiness, fewer roller coaster glucose readings, and a better sense of control. That said, always put safety first. If this felt useful, try the 7-day plan and share your experience below. What did your glucose log say? Did your ankles measure differently? Tell us what you noticed so others can learn. And if you found this helpful, share it with a friend or family member over 60 who might benefit. And subscribe for more practical, science-aware senior health tips. Take care and check with your clinician before making major changes.